able to gain access to all the services that we actually would require during our everyday life. Now, for example, live in Beijing, where I can actually access the Beijing government portal through WeChat. And within that, I'm able to access, for example, traffic management system, health code system, my tax situation, all through one single interface. This actually made everyone's life a lot easier, but also making sure that everyone is able to access the necessary information with ease. And thirdly, the emergency management platforms being set up by the regional governments. This allows the provincial governments to this allows the provincial governments being able to visually see the real-time situation as the virus spread. And it also allows them to utilize all the different resources within the provincial region to provide the necessary support to the most needed areas. But one of the most obvious impacts is going to be the healthcare industry. During the crisis, we have seen over 80% of the hospitals in China upgrading their core HIS system, which is Hospital Information System. By the same time, we have seen the introduction of emerging technologies such as artificial intelligence and 5G and cloud computing being more accepted at hospital level. To fight the virus and the crisis, we have seen new hospitals being built in a matter of days. But these hospitals are also using first-class technology skills and tool sets to allow them to making diagnostic decisions more quickly and efficiently. Now, on the other side of the diagram, you can see that first of all, there is President Xi of China using video collaboration platform to interact with the hospital staff within one of the newly built hospitals in Wuhan to actually, number one, gain an understanding of the real situation on the ground, but also to provide and offer his support to everybody who's actually in the middle of fighting this particular crisis. And also, we can see that in those hospitals, the medical staff are using video collaboration technology to work with the experts from other cities to jointly provide their diagnostic opinion to particularly difficult cases when treating a patient in Wuhan. And finally, artificial intelligence is now being widely recognized within the drug development and research industry in order to speed up any development of new drugs. Thirdly, I mentioned earlier that this pandemic actually has changed the way everybody lives, socialize, learn, and work. And technology actually is helping people to return to their normal life. Now, once the pandemic is under control, we actually want everybody to return to their normal life as quickly as possible. But at the same time, we want to ensure that they are able to work in the safest environment. So we have seen the installation of voice-controlled elevators. And this is just one little device that's being installed in the elevator to reduce any person actually connecting or contacting the keypads, therefore lowering the risk of cross-infection. But within every single building in China, we have seen the implementation of infrared temperature sensors as the first line of defense. As I walked into my building this morning, I actually had to go through several rounds of checks to ensure that my body temperature is in the normal range. Within some of the high-tech business parks, service robots are being deployed to actually deliver the essential items that our staff will need to resume their daily work. Again, this is to avoid further man-to-man contact, therefore lowering further risks of infection. And finally, before we actually allow our workforce to return to their normal life, we wanted to make sure that they can actually work in the safest environment possible. In certain regions of China, we have seen manless drones being deployed to making sure that that particular area is being sanitized. All of these technologies are actually helping everybody to actually return to their work in the quickest manner possible, but also in the safest manner possible. But during the fight for the virus, we actually have seen an important role being played by logistics. At the beginning of the crisis, we actually saw what we call the Wuhan swingman, acting as the bridge between the citizens living in Wuhan and the food and water supplies they need whilst they're being placed under quarantine. This also made sure that our hospitals and medical staffs are receiving the necessary medical supplies to actually treat any patients they may receive. Further down the line, we saw the use of robotics and drones being deployed in hospitals to deliver food and medicine to their patients. This is again to avoid cross-infection to our medical staff who are actually key in this whole fight against the virus. And outside of Wuhan, we actually saw a surge in e-commerce activities. And one of the platforms actually the government actually is putting in place in order to control the virus spread. So during this pandemic, we have seen rise in requirements in the transportation industry overall in terms of the use of intelligent IoT devices. Now, these include infrared temperature sensors, facial recognition cameras, service robots and drones throughout the entire industry. But in the long term, what we are also seeing is the Chinese government releasing necessary policies to drive the further digital transformation of the transportation industry as a whole. And this is called the China New Infrastructure Initiative. And I'll talk about that later in my slides. And what that will result in is the further increase in the use of intelligent IoT devices. Now, we talked about facial recognition and drones and robots, and these will be further deployed in different stations and traffic hubs in order to manage our accidents and also our overall transportation system. One of the more obvious impacts this pandemic had is changing our everyday life. And one of the most concerns for most of the families in China is our kids' education. Since the pandemic began, schools are closed, and what we saw is the online classes replacing real-life classes, and that began in February 2020. And these platforms are actually built by either provincial or city governments in China. The most of the online platforms are utilizing public cloud technology, combining with artificial intelligence as an example, so that it allows interaction between the teacher and students during live sessions as if you were in a real classroom. But it also offers recorded sessions for those who were unable to attend the live session so that they can actually catch up with their lag behind education that they may require. Now, this isn't just for the kids in the city, but it's for everyone. Imagine that there are over 200 million learners in primary and middle school in China. So the amount of connectivity that's required to support such system is massive. And for those who do not have access to broadband connectivity, they're having to rely on mobile connectivities to access their online classes. And that means this particular case will further drive the development of 5G network build-up within China. And what we can imagine is that in the future, this online classroom would actually remain as the pandemic slowly disappear. And we will see it's a new way of learning slowly emerging within the society where we're able to combine online and offline education for all of our kids. And to be honest, my kid, for one, is actually enjoying the experience. He loves the fact that he's able to interact with his teachers and classmates on a computer. And it's all new for him. And the actual end result was we have seen an increase in his learning efficiency. So that's actually a silver lining. on all of this pandemic crisis. As our life is slowly returning to normal, what the Chinese government is also trying to do is to raise the technological capabilities in the country. Therefore, it's releasing a new initiative called New Infrastructure. What that means is that it actually creates the necessary infrastructure base to support the development of next generation technologies, such as 5G, industrial internet, artificial intelligence. And all of these will be through the build out of next generation data centers throughout the country. What this would also mean is that the convergence of old and new infrastructure, such as ultra-high voltage lines, high-speed rail, and new energy vehicles. As we slowly see these new technologies merging into different industries, it would allow China to actually further raise its capabilities across all different sectors. By introducing technologies such as artificial intelligence into the new medicine research and development process, we potentially could see 20 times faster in terms of the introduction of any new medicine to the market. And that's going to bring huge benefit to the society and its ability to cope with any future potential crisis such as the one that we're facing. Finally, as a business, what do we do? From China, what we learned is that during any crisis, we need to have the ability for business continuity. And our advice is that, first of all, we need to start building a digital capability of any organization, especially for any critical assets and processes within our organization, so that we are able to run diagnostics and monitoring remotely during any potential crisis such as the one that we're facing. But we also need to recognize the fact that we need to immediately start the development of IT and OT data governance and convergence. What that means is that we have all seen the power of artificial intelligence, but such technology is not going to be effective without data. And any organization that holds enough data will be able to feed into any algorithms that artificial intelligence technology will depend on to actually make meaningful decisions. So any organization that's facing such crisis will need to get itself into a position where it's ready to provide the algorithm with the data that it needs. And finally, we need to implement a decision-making support structure. We'll use the technology such as AI to give our business decision makers enough guidance for critical decisions. Now, we all know that humans are prone to errors, but AI is not human. It's not prone to errors. It's going to make decisions based on the data that we feed it. So it's actually able to allow us to make a judgment or a better judgment during any crisis. Now, I hope that my sharing has been useful for any country that's already facing such crisis like the one that China just faced. Now, what I would like to emphasize is that by utilizing technologies that's available to us, we're able to come through these crises more efficiently. And finally, I wish everyone stay safe and healthy. Thank you.
On the front line, healthcare workers across the globe are making huge efforts and sacrifices on all our behalves. How can ICT help us help them? Here in China, for example, AI has actively helped doctors accelerate the diagnostic process, boosting test efficiency by up to 6 times. Let's go to Shanghai now and hear from Professor Jian Zhou, Vice President of Shanghai Zhongshan Hospital.
Ladies and gentlemen, I am Zhou Jian from Zhongshan Hospital of Fudan University. Today, I would like to share with you lessons we have learned in saving lives with science and technologies. Our hospital is a medical institution under the National Health Commission and the biggest one among hospitals affiliated with Fudan University. Zhongshan Hospital is home to many national clinical research centers. We have specialties in internal medicine and the surgical department that top the country. We recognize the importance of technology commercialization and enjoy a good tradition of commercializing patents that help with frontline diagnosis and treatments. Our commercialized patents make up over half of all those in Shanghai. Professor Fan Jia and my research team worked on a new test kit, a patented technology. It has been put into clinical use already. In addition to that, fellow Ge Junbo's team invented the world's first stent that can reduce the probability of clotting by over 50% according to a number of research findings. Zhongshan Hospital has been collaborating with the businesses. On April the 22nd last year, the world's first innovative PET-CT system was introduced to our hospital. In the fight against the Covid19, we have made an all-out effort with technology. On January the 23rd, we sent a team led by Professor Zhou Ming, the Deputy Chief of ICU. He was the first doctor from Shanghai to help Wuhan. After that, we sent 4 more teams composed of health workers from respiratory and ICU. On February the 7th, Deputy President Zhu led a team of 136 people to Wuhan, joining the front line. In addition, we have 17 experts at the Shanghai Center for Public Health, which is the South Campus of Zhongshan Hospital, designated to treat coronavirus patients. Our chiefs of infectious diseases and respiratory and ECMO experts are all there, provide expert opinions for the front line. We also send out experts to help local hospitals across Shanghai. Fellow Ge's team have invented an antibody test kit for coronavirus. The IgM and the IgG test kits have over 95% of accuracy. We provided them to many countries for fast testing. It produces test results between 20 seconds and 10 minutes. Based on our prevention controls and clinical diagnosis and treatments, Zhongshan Hospital invented a buttoned mask that helps reduce fertility from respiratory failure from 25% to 9%. The mask is widely recognized. It has played an important role in combating COVID-19. Deputy Respiratory Chief Professor Jiang invented a nose mask for medical use. Health workers may get infected when they eat in the dining area on a ward. Such a nose mask can prevent that from happening. We filed a utility patent to the National IP Office. The nose mask has been put into use in Wuhan. Let's watch a video.
在湖北省人民医院东院区重症病房，刚刚下班的。医护人员正在吃饭，他们脸上都带着一款被称为鼻罩的防护装备。通过这个鼻。 这
罩把鼻部遮挡起来，然后通过鼻罩进行呼吸。那么这样子的话，在饮食的过程当中也进一步降低了可能感染的风险。
这个新发明是复旦大学附属中山医院第一批援鄂医生、呼吸科副主任蒋进军提出的。很快，这款为医护人员就餐提供呼吸道感染防护的鼻罩诞生了。
它是参照了外科口罩的一个设计外面是防水层，里面有过滤层，还有一个吸水层，包括后续的复工以后，工厂、学校等。
People can wear the nose mask to protect themselves in factories, schools, and airports. You name it. The frontline health workers in Wuhan invented a new mask that can filter the expired gas. It reduces the risks of health workers being infected and the risks of patients infecting each other. Our Deputy Chief of Infectious Disease Control, Mr. Gao, invented a device for sterilized tissues. It is a cost-effective way to ensure that the tissues are bacteria-free. We have stepped up research efforts in the coronavirus. Professors in the respiratory and infectious diseases are able to boost their research with funds from Shanghai government and the national government. Fudan University has